word, it can also be a symptom of ADHD and issues with the left hemisphere. And because so much of my training in these areas stems from Dr. Robert Melillo's work, I'd like to review the right and left hemisphere very generally that we talked about before. Okay. What we're going to do is we're going to talk about, I'll start with the left hemisphere. And in the left hemisphere, the reason I'm starting this way is because you'll see how this then reflects back or is involved with yourself or your child's behavior or family, friends, whatever the case is. So let's start with the left hemisphere. The left hemisphere emotions are happiness, surprise, and anger, and a little bit of joy also tied in with the happiness. Now, think about how that would apply to someone with ADHD or autism and angry outbursts, right? Because that's where anger resides. Most super, super strong, or if it's that much of an imbalance, because this is an imbalance. It's not I got to tell you, there's no genetic mutations in this. What you want to do is think about a term epigenetic, meaning your genes are there, whatever you inherited. And yes, there are familial ties because you inherit your potential from your parents and their parents, et cetera, et cetera, et cetera. So what you want to do is think about things turning on and turning off. Okay. They haven't tied it into any genetic mutation and incorrectability, meaning we can't do anything with it. There are things that we can do to help improve brain function and balancing. Now, with a strong left hemisphere, or we'll just talk about hemisphericity, but you've got happiness, surprise, and anger. Think about how that would tie into an angry, or you try to take your ADHD self or your ADHD child away from something or take something away from them. You are going to get happiness while they're doing it, happiness while they're achieving things, but then we're going to get surprised that you stopped them, and then an angry outburst because they did not want to finish. So we've got all three of those emotions. You also have to understand that left brain isn't super aware of anything else, of itself and its surroundings. And we'll talk about that more with the right hemisphere. The left brain is very selfish. The left brain is very unaware, as I just said. It's very detail-oriented, and it also is the initiation side, okay? The right hemisphere, on the other hand, the emotions there start with happiness and joy, but you also have all of the other emotions. You have sadness, you have disgust, you have shame, you have guilt. The reason you have these, and this is the avoidance side, the inhibition side, okay? The right brain is really important. The left brain is selfish, self-involved. The right brain is social. That's what allows us to stay in the group. It's self-aware as compared to selfish, right? Self-aware, selfish. And that self-awareness allows that person to be aware of others. Because if I'm super left brain and I am a very needs-based, very short-term focused attention, and we'll talk about that later also, very focused attention right here, right now, very linear driven, very needs and my needs, right? Is compared to a right brain, which is very socially aware, fitting in with a group. You've got to remember, we haven't always had supermarkets. We haven't always had homes. And even now, we're still hardwired. Most of us are still hardwired to want to and try to fit into the group. Whether it's good or bad, we are very group and socially oriented. And the right brain is the side that helps influence that. And that's where you would have the disgust, the shame, the embarrassment, the guilt. All of these make you feel bad, and they also could get you ostracized from the group. If you're doing something that's shameful, you're doing something that's disgusting, all of that could get you pushed out of your society, your group. And centuries ago, and even in a lot of places today, if you don't fit in with the group, you don't survive, right? So along with that, you have, like I said, a little bit with the left brain. The left brain is very linear, very detail oriented, very short term goal oriented. The right brain, on the other hand, is very big picture oriented. So the right brain sets the goal. You want to achieve that. You want to earn that. You want to be that. Then when they're in balance, you have the right brain sets the goal, and then the left brain starts achieving it, starts doing the minute by minute, hour by hour, day by day, week by week, achieving short-term goals to hit the right brain long-term goal. So that's the hemispheres in a very general nutshell. Now let's think about, if we can, let's just jump right into ADHD. ADHD is usually an increased left, as I was using as the example earlier, a left hemisphere with a decreased right. You've got attention deficit. This is the big picture long-term goal. So now you lose that long-term focus, and this is the go side, the initiation side. So that's the hyperactive side, isn't it? So remember, if the right side is inhibition and this is initiation and they're not in balance, ADHD, attention deficit hyperactivity, then we've got no inhibition and nothing but initiation. Everything's a good idea. Everything's something I should do right now. This is what I'm going to do. And if it gets too extreme, now I'm focused on this. I'm not going to leave this till it's done. I need to finish every little step, every detail. And this might be the person that gets lost in the details and lose sight of the big picture. Again, there's a real good book for that. The Master and His Emissary, phenomenal for adults to read. Very in depth. It was a really long read for me, but it really gives you a big, gigantic picture by a European. I believe he's Irish. Anyway, the name is Ian McGilchrist. Phenomenal book. What the Master and His Emissary. The master tells the emissary what to do, and he's got the big picture: keep the city, keep the county, keep the country, keep the empire going. And then he tells all of his little emissaries what he needs to do to achieve that big picture, loving organization, community, et cetera, et cetera, et cetera. With ADHD, like I said, it's usually an increased right, decreased left. But let's talk about type 1. The first thing you want to do with ADHD is ask, what type is it? And I'm going to give you that. Type 1 is usually inattentive type, decreased, and if you remember what we talked about last week, a decreased right dorsolateral prefrontal cortex. And remember what the dorsolateral prefrontal cortex is? Well, you don't have to remember because I'm going to tell you right now. The dorsolateral prefrontal cortex is the area that makes those executive decisions, putting things together, planning, organizing, deciding whether it's the right thing to do, okay? And then push over to the left, initiate all the right things to do, and then inhibit the things that might distract you from the right things to do. Remember, the forelock is hugely important, and the dorsolateral prefrontal cortex is that executive function, decision, planning, all of that. Okay, so you've got, and you also have hugely inattentive. Like, remember, you lose the focus, the long-term attention span, because now you're hyperactive. It's also associated with the dorsal or parietal stream, and that is very much the where is it, how is it, visual and auditory pathways. And this is important because when we come to how to improve things, we can use hearing, we can use vision, we can use all of our senses. So that's why it's very important. You can remember that. You don't have to remember that, but I'd recommend it. The dorsal stream, the where is it and how is it done, part of your senses of hearing and vision. That's type 1. Type 2. This is the hyperactive, impulsive side. This is usually a dramatically decreased, right? Remember the orbital frontal cortex we talked about up here? That's closely tied to emotional, social behavior. Inhibition on the right, initiation on the left. So imagine you have no inhibition, no inhibition. You're blurting out, you're saying inappropriate. You don't do things socially and behaviorally to fit into your social group. So type 2 is hyperactive and impulsive. It's also about the orbital frontal cortex, about inhibiting abnormal impulsive behavior, social behavior. It also may have, if you've ever heard of habit formation, that's right behind the orbital frontal cortex in a place called the basal ganglia. That's where, if I can give you an example of how that works for all of us that tie shoes. I'm not a big fan of Velcro shoes. Number one, I think it looks horrible. But no, number two, the idea is if I asked you to teach me how to tie a shoe, it'd be a nightmare. I mean, picture just for a second while I'm talking, try to figure out how you tie your shoe and how you would tell me if I say, how do you tie your shoe? Step by step, tell me. Picture that. And I can't, because it lives in your basal ganglia. That's your habit. Boom, there we go. And that's the short-term habit. It could be a long-term habit. It could be, short-term behavior, long-term behavior. Driving your car to work every day, or if you live in a city and you take the bus, you come out of your house, you come out of your apartment, you make that walk. I jump into my car, I throw the bag in the front seat, close the door, I lock the door, I turn the car on, I wait a moment or two. I check to see if any of the doctors that I follow posted after I went to bed last night. Then I'm a little warmed up. I like the engine to get going, and then I back out and I go. And then I'm at the office. Hopefully I'm trying to be a safe driver, but that's basal ganglia with long-term, a 30-minute drive, and even short-term tying my shoes. That's where habits are formed. Hugely important, because it can be physical habits, mental habits, self-talk habits, emotional habits. Imagine if you have ADHD and it's really, the right and left are really imbalanced. A very, very weak right brain and a very, very strong left brain. All the initiation, and how easy is it to form bad habits? Or the children that have to do this exact pattern. Or imagine OCD, tics, that's a physical habit, a physical movement. OCD, obsessive compulsive behavior, a left brain issue. Imagine if you don't have the right side orbital frontal cortex and these things, dorsolateral prefrontal cortex, to override the initiation of bad or inappropriate habits in terms of physical, emotional, mental, all of those, okay? And those live on the left side. Type 3, that's a combined type. That's going to be real, again, though, really decreased right, really increased left. This is also going to give you your, how would you say, most ADHD kids are going to be early learners, early readers, early writers. It's really very verbal, because those are on the left side. And that's why a left deficiency, and we'll talk about it in a few minutes, is dyslexia. That could be dyslexia. You've got the left side. Some of the strengths, again, would be word finding, understanding the definition of that word, okay? Then we go over to the right side. That's the comprehension, or the big picture of the why the author decided to write in those characters, the why of the behavior of the character. It's the big picture comprehension. So early on, the kids look great. They look super smart. They read early. Oh my goodness, I've got an A student. But then what happens is the anger, the combativeness, the the impatience, the surprise, the disappointment starts to develop later on in school, because as you start getting past letters and words and just the definitions, we need to get into comprehension and inference and intentions, and that's all on the right side. Okay, that's the big picture. That's self-awareness and societal awareness, as compared to the left is very self-involved, very intentional, very short-term goals. All right. And it's also where your Broca's and Wernicke's areas are. And those are your word areas. And if all these titles and things, you can certainly search them up. You can play the video slower, pause it, stop it. But all of your word finding and word usage, sentence creation, that's the left side. The big picture understanding of the paragraphs in the book are on the right side. Now, when you're looking at ADHD, it's really, really important that it can't be just in school and not at home. It can't be just at home and not at school. It has to be seen in at least two environments. It would be school, home, and social. So if a parent is having problems at home, but I've got a student that's great at everything, a good athlete, really smart, both right and left, then it's a home problem. If they do great at home, sitting there doing their homework, and they're not easily distracted, and everything within the family structure appears normal, but they've got a problem at school, then it is a school problem. It has to be seen at least in two environments, and it should also be for at least 6 months, because even the brain has growth spurts. So when one hemisphere is starting to come online really strongly, there might be some adaptations. It's like a physical growth spurt. You could be a great athlete in 5th grade, and then all of a sudden you have a gigantic growth spurt and you pick up 3, 4, 5 inches all of a sudden. So you go into 6th grade and the child can't hardly walk right. Does that make sense? So the same thing happens within your brain as, say, from conception all the way to the age of 2. So almost the first 3 years of the child's life, it's mainly right brain, learning about society, learning about its environment, learning about itself. Then the left brain kicks in. It's got a little bit of information, so now it wants to put it all together, figure it out, start learning, start applying, start talking, practicing, controlling muscle movements of the mouth, of the whole body, right? So you've got these brain growth spurts, just like you have physical body growth spurts. One of the things I'd like to point out early is literally, if the child is diagnosed with ADHD, and this is general, very general, and I'm not a psychiatrist and I'm not a medical doctor, so this is very general application. Usually, if the stimulant medication is given to an ADHD child, if the medication works, stimulation, right? If the medication works, then it's probably a right brain delay, because isn't that the inhibition side? If the medication works, that's the avoidance, that's the inhibition. Now we ramp that up. That balances out the overaggressive, strong left side. So that's usually an indicator. If the medication works, it's usually a right brain delay. And as a parent or a caregiver, as a teacher, behavioral therapist, all of that stuff, you can still, when we talk about solutions and helping children and adults, people with ADHD and dyslexia, you still want to realize, which hemisphere am I? Think about, which hemisphere am I working with? Okay. And if the medication works, it's usually a right brain delay. If the medication doesn't work, it's usually a left brain delay. And we'll go into why that's so important. True ADHD almost always shows decreased right inferior and superior parietal lobes. This is why a lot of ADHD kids that I've worked with don't have good muscular control. They usually show poor posture. It's very awkward. The right The right side is the shoulders, the arms, the legs, the torso. That's the large muscle group control mainly. And then it's right side controls left, left side controls right. But the right side is the override for large muscle control. The left side of the brain, remember ADHD, if the left side is super strong, that's the fine detailed stuff. That's the early handwriting. That's the nice tight letters. Right brain, if it's an exceptionally strong right brain and a very weak left brain, when they do write, it's usually big letters. It's not as neat a handwriting. Left brains usually write very detailed, very clear. I tend to lean right, so my handwriting is kind of sloppy. But that's true ADHD. Usually shows a decrease here also, because, it's a strong left and a weak right. And the superior and inferior parietal lobes for spatial awareness, along with self-awareness and spatial awareness. Now, let me ask a couple questions referencing hemisphericity, because like I said, this hemisphericity is huge in this. I'm going to ask you real straightforward. Think to yourself, answer to yourself, whatever you want to write down. Type 1, inattentive, distractible. Which hemisphere is type 1? Inattentive, easily distracted. Is that a left hemisphere deficiency or a right hemisphere deficiency? And there are no type 2 symptoms involved. Okay, to answer your question, everybody, that's going to be a left hemisphere deficiency. Because it's a left hemisphere deficiency, yes, yeah, exactly. From Geechee, you nailed it. It's a left hemisphere deficiency. You've got to understand that the inattentive and easily distractible, imagine if it's a super strong right brain. One of the keys to a super strong right brain is not only being self-aware, that's the basis. Right brain becomes self-aware. This is how I move my hands when babies put their hands and feet in the mouth, everything goes in the mouth, and they learn to control that. Large muscle movement, right? They can't write yet. They start with self-awareness, but that self-awareness now opens up and allows them to be aware and apply their self-awareness. That smile means happiness. That frown means anger. The down face might mean fear or anxiety, right? They may not be able to define it, but they know what it feels like because they know they're self-aware. Mirror recognition. Strong left brains usually don't have mirror recognition. They don't. Babies eventually they love looking. They love looking at themselves. Okay, when they finally understand that mirror and that's them, they like looking at themselves. They want to look at themselves. Left brains, they don't make eye contact. They don't look at themselves. They're not even aware that that's themselves and that's them in a lot of cases. So imagine if it's inattentive and easily distractible, the left brain is not allowing them to give focused attention. The right brain is super aware of stuff, so it's also aware of its surroundings. I learned this in school. I didn't realize when I was younger that sitting in the back, away from the teacher, I always wanted to be like not seen, not heard. I really did. I was terrible. Hated public speaking. Oh my gosh. I mean, fear and anxiety like nobody's business. But what that did was that allowed that stronger right brain, because like I said, there's a test and you can actually measure how far over you lean either way. I lean a little bit. So imagine somebody walks by in the hallway. Immediately I'm looking. I hear something. People move over here in the front part of the class. I'm looking. People are whispering over there. I'm looking and paying attention. I was hyper aware of everything. So I was very easily distracted. Type 2. What side deficit would that be? Type 2. And if you want to, you can type it in because I see it on the Zoom stuff. Where's Geechee? Type 2 is which side? That's going to be a right brain deficit because remember, that's impulsive, that's hyperactive, Absolutely. That's hyperactive. That's no inhibition. Okay. That's all intention. It's that's the Australia. Oh yeah. It's definitely it's it's the type 2 is a right brain deficit, very impulsive, very hyperactive, very compulsive. There's no inhibition. So then type 3 is going to be what? And this you can say it's a combined problem. Type 3, as we talked about earlier, you're going to look at there's a right brain, left brain imbalance. And here you're almost always, and then there's analysis that I do. Yeah, good. It's both, because what happens is you usually have way too turned on left and deficient right. So then we have to deal with that also. Usually when I'm dealing with a patient, more children than adults, but even in adults, when I'm dealing with a patient with ADHD, I'm targeting the deficient side, the deficient hemisphere. That's the whole foundation of it. Well, and we're also doing primitive reflexes, especially in children, and we can talk about that on another occasion. You should search that up and see what primitive reflexes are. It's really cool. Most of them, all of them should be gone by 12 months, and some of them as early as 4 and 5 months. One of the really cool reflexes you can check on each other, but you cannot check it on yourself. Imagine what's one of the first early signs for a form of autism. A form of ADHD, or even more intense autism, which is really severe ADHD. Autism, one of the first signs for that is, yeah, that too. Absolutely. Because what happens is there's no muscle tone. That's a great answer. Bending body parts backwards. Hyper elasticity. There's no muscle tone, right? Because if you're typical ADHD or autistic, it's more left, very weak right. So what happens is you lose muscle tone, and you're not controlling large muscle groups. So it's horrible posture, horrible muscle tone, very little actual strength in terrible core. And that's one of the things we really work on, especially with autistic kids, but with all the ADHD. But what happens is one of the primitive reflexes is called the rooting or sucking reflex. Remember, babies they aren't taught. They already know, most of them, how to breastfeed, how to suck on stuff, bottles, their feet, you put your finger, their thumbs, they're always chewing and sucking, chewing and sucking, chewing and sucking. If they don't latch on early, then they are probably missing that rooting or sucking reflex. There's no awareness. They may not even realize they're hungry, to be honest with you. The more severe the ADHD, the more severe the autism, a lot of people lack so much self-awareness that they don't even know, they don't understand thirst and hunger. But imagine all you have to do, and especially with an adult, for those of you who have someone there, or you don't have to do it right now because we're all aware of it and talking. But one of the things I always check, even on adults, and I've had adults that still have this reflex, the rooting or sucking reflex, breastfeeding reflex should be gone, is you literally stroke the cheek all the way and touch the lip. Stroke the cheek or chin, lower cheek, and touch the lip, right? And do that multiple times. A baby, a breastfeeding baby, the minute something touches their cheek, they start to turn and purse their lips. Imagine I've done that. And the last one, a gentleman, he had some brain trauma, and I ran through my primitive reflexes. That's the first thing I check is primitive reflexes when it comes to brain trauma and any functional disconnect syndromes. And he still, in his 40s, had a rooting reflex. Imagine he's got the brain function, or there's still brain function, of a 1-year-old or less. And this is showing up in a 40-year-old. So think about how much interference in his adult mind, right? How much interference, since his these reflexes that should be gone, they're still interfering with his normal brain function. It's still there. 40 years old. It should have been gone 39 years ago. So that's a huge issue. And let me jump into, before we get into dyslexia, I'd like to move into a little bit of autism too. And that's what I just did. One of the earliest signs of autism, extreme left hemisphere strength, is the lack of ability to latch on while feeding. This is also indicative of really other hyperactive primitive reflexes interfering with the cranial nerve control. Okay. So your cranial nerves are hugely important. There's 1 through 12. One of the big ones, number 10, is vagus, controlling all of the digestion and stuff. If things are off, if your brain stem is off, digestive disorders, heart, lung, respiration, the cranial nerves for vision and smell. Everything right there in your brain stem. If you've got issues in your brainstem, and imagine if you're 40 years old, in your 40s, and you've still got primitive reflexes, you've got issues in your brainstem. You could have hyper or hypo blood pressure. Both of them are huge problems. Imagine too much blood pressure, things give out and die. Hypo, there's not enough blood flowing, things aren't functioning at their best. Now your body stresses out, gives out, and dies, right? So brainstem and primitive reflexes are really important. And like I said, that's why I check them all on brain trauma, my stroke patients, motorcycle accidents down here, and accidents in general, but any kind of brain trauma. I've got a student athlete right now. She took a hard fall and real bad concussion, and like 6 months ago, I believe it was, and she's still suffering, and she's getting better. And a lot of that is her parents are helping immensely because there's a lot of homework to do. But let's go into autism again. Imagine what we're doing now is a lack. Think about it. If it's severe, really, really severe ADHD, if I can generalize it that way, imagine we've got a lack of social abilities. So we've got a lack of social contact. You've got a real devout decrease in stimulation for the brain. And it's also a lack of ability because you're not even aware of this need, right? First, yourself, you're not real super self-aware. That's the right brain. Autism is way over here. You're not aware of yourself, so you can't be aware of others. You can't build relationships. There's no need for attachment. What did we say? I think we said this before in our brain talk. Most psychopathologies are left brain issues. Think about why that would be. If all you experience is happiness at getting your way, surprise when you don't, and anger when you don't, and you have no other societal awareness, it's going to be immediate, short-term self-pleasure, and the left side is pleasure. The right side is avoiding pain. The left side is usually pleasure seeking. That's why the addictions are usually left-sided hyperactivities from drugs and alcohol, food, all those. All of those are actually abnormal habit formations. Okay, and too much, right? There's no inhibition there. Imagine the autistic person that is way over there. There's no need for eye contact. I had one patient, I think I mentioned before, a young man, 15, 16 years old. His mother used to always tell him, look at the doctor when he's talking to you. And one of the reasons the young man listened to me so much is I wasn't a threat to him. I very politely, I told her, I can't remember exactly how I said it, but I'm trying to be polite because the parent is the authority figure. And I said, oh, no, that's okay. He doesn't have to look at me because he's responding immediately to everything I say. He's paying attention to me, and he's doing everything I ask him when I test him, when I ask him to do something, to show me something, to do something, lie on the table, sit up, do this, do that. He responded immediately. So I knew he was paying attention to me. And because I'm aware of my training, I realized if I made him look at me and maintain contact, he was ADHD. He was borderline. They were trying to figure out whether he was autistic or not. And I know he can't read my facial emotions. So he doesn't want to look at me because it doesn't mean anything to him. If he says something to me and I respond, he knows I'm listening. If I say something to him and he responds, I know he's listening. He didn't see the need to look. And it's really interesting. Most ADHD and most autism, balanced, balanced brain function, when the left and the right are working real close and in sync with each other, and you can lean to the left and you can lean to the right. That's most of us do. Very few of us, I think. I've never tested anyone that was 50-50 on the test. But when you're up here in what we call however we say it, there's neurodivergent and all that stuff. Let's pretend it's neuroconvergent. So when you're in that stereotypical normal stuff, neurotypical, thank you. Neurotypical. When you're neurotypical in this society, then you tend to, how would I say that? You look at the eyes and the upper face for expressions. When you're neuroatypical in this society, when you do look at someone, you usually look at the mouth to try to read emotions. And they've tested it with the eyes and the videography and things to see what people are looking at and what they scan. Neurotypical typically does the whole face, emphasis in the eyes to read emotion. Neuroatypical, almost locked completely to the lower half of the face. And one of the reasons we think that happens is because where's the voice coming from? I'm going to pay attention to where the voice is coming from. Where are the questions? All of that stuff. And they tend to be very literal too, because you're missing that big picture awareness. Now, if we can jump into dyslexia, who wants to answer the question for all of us? Dyslexia is a right brain or left brain deficit. Left, exactly. You're killing it, alhamdulillah. Dyslexia is a left brain deficit. And why? What are some of the indicators for it being a left brain deficit based on what I've already said about right brain and left brain strengths? Broca's area, word finding is left. If there's a left brain deficit, they can't find the words. Wernicke's, word definition and understanding. If they've got a left-sided left brain deficit, they don't even understand the words, or they have a hard time hearing your words and learning them. But think about it. Also, with dyslexia, and a left brain deficit, dyslexia, think about, I'm going to read this to you. It is a language-based disability, a language-based disability. It's not just a reading deficit. There are so many different reasons for a reading deficit. Imagine, believe it or not, imagine your cerebellum, the back part here. Everybody talks about that's what they test with. Alhamdulillah, Muslims don't have to worry about it. We don't have to worry about being pulled over and failing a drunk test, right? But your cerebellum, smooth, coordinated movement. We know now that not only is the cerebellum important for smooth, coordinated movement, it's also important for smooth, coordinated thoughts. It's also important for smooth, coordinated emotions, all three of those. So imagine if your smooth, coordinated movement is off and you're not controlling your eyes right. Some people, and we know them as adults, their eyes are off center. So imagine as I'm reading across on a sentence in a book, and one eye is a little out more than the other. When I try to focus on the word, imagine I'm reading the one word, my other eye is registering two words down, or even if it's off just a couple of letters. Now that word doesn't make sense to me at all. And now I've got to go back. Then your brain has to figure out which eye to believe. Imagine if they're up or down. One eye And it's no exaggeration. Imagine one eye is up, the other one is down. One eye's paying attention to the one sentence, the other one is at the sentence you already read or the next sentence coming in, and your brain has to sort that stuff out. You could spend forever trying to coordinate that. Now imagine you're just learning how to read and you're dyslexic. Oh my God, you're going to hate reading. You've trained it in. It's hard for me. I can't do it. I don't want to do it. I'm frustrated. And with dyslexia being predominantly a left brain issue, imagine how upset you are. That's weak. It's a weak left brain. So now your right brain, you're very self-aware. You know the kids, you're worried about yourself. You know that you're hyper aware of how the other people feel. You know that the guy next to you doesn't like it when the teacher asks you to read out loud because it takes you forever. You're embarrassed. You're self-conscious and sad, right? Embarrassment. That's all right brain emotion. With dyslexia, huge issue. And this is one of the solutions to it. But dyslexia and the left side, that's also hugely important for speaking. Because if you have dyslexia, you have a hard time learning letters, combining letters to make words, and combining words to make sentences. You've got a hole in the left brain, remember? Big picture, big muscle movement, detailed muscle movement, and motor planning. Motor planning is on the left-hand side. So now think about how hard it is. One of the hardest things to do is talk correctly. You've got to control, talk about fine motor movement. You're moving your lips, you're moving your tongue, you're breathing, you're using your voice, you're tying in your lungs, you're getting brain function to tell all of this, bring it together. One part says, okay, this is what we're going to say. The other part says, okay, can we say it? Have we said it before? Your basal ganglia goes in and says, oh yeah, I've got a pattern for that. Your cerebellum makes it real nice and smooth. Then it comes back up front and you initiate the movement. Imagine coordinating all of that, and you've got a weak left hemisphere, which is motor planning. Now you can't plan that movement correctly. You can't even sound them out. You can't learn to sound it out. Dyslexia, even after they learn to speak, it's still that problem in motor planning. So it's a nightmare for reading, writing, and speaking. And dyslexics usually with a weak left brain, they have a diminished ability for focused attention, right? Remember I gave you my example when I used to sit in the back of the room when I was in school, high school and stuff. In chiropractic school, they knew I was up front. I was one of the first 3 rows. I always sat and I tried to dead center that thing. And once in a while I was late to class. If I ever got trapped in the back, it was a nightmare of a class for me. So you can imagine my motivation to sit up front. I was driven to sit up front because this material was hard. It was important. This is what I want to do. This is what I know I'm going to do. That was the big picture. My left brain took over, made sure I was early for class, made sure I was ready to take notes. I was right up front. Okay. Dyslexics, they don't have weak left brain. You may want to be at class early, but you can't narrowly focus. You forget, you lose track of time. If you don't have a strong left brain, you usually don't have a strong time frame either. Dyslexia, also hugely important. Like I said, think about it. It's usually remember how the right brain and ADHD, that's usually, a lot of times that'll involve the parietal lobe up here. The dyslexia usually involves the temporal lobe and word processing problems. This will include, like I said, sounding words out. If you can't teach yourself what that letter, what that word sounds like, how are you going to understand to follow directions and to listen well? That'll be awful for you too, if it's diminished enough, if you're literally diagnosed as dyslexic. Dyslexics, is a left brain activity, or focused attention is left brain activity. Attention focused problem without hyperactivity, usually an underactive left brain. Now, some solutions. 721, excellent. Some solutions for this. And this is something that could be important for all of us. It's not just dyslexia. It's not just autism. It's not just ADHD. It's not just Alzheimer's. But there's some really good research particularly targeting Alzheimer's and autism, believe it or not, where if you decrease, for all of us, if you decrease your caloric intake, you decrease the amount of food you take in. That's why all these different diets, when you decrease caloric intake, not just a certain type of food, but the amount of calories. That's why Ramadan is so beneficial for us. You decrease your caloric intake and you increase the body and the brain, especially, in a really cool word called autophagy, autophagy, meaning eating and cleaning yourself. So what happens is your cells that do that, when you're not eating and you're not dealing with food breakdown and the blood flow isn't digestive and all that stuff, your energy, rather than breaking food down and making sure it's safe and your immune system paying attention to your digestive system, now when you're not digesting and breaking down new stuff and there's no new threats, you actually clean up and improve brain function. And then you move into like a ketosis diet and ketones and using body fat in the brain. There's a lot of research showing that brain tissue, brain cells actually work better on ketones than they do carbohydrates. But it's really cool because just for autophagy or that cleaning part, it'll improve brain function and get rid of the waste products that are up there. Hugely important in Alzheimer's and autism, but that's for all of us, literally. And then there's different research. You can talk about 12 hours, 16 hours. Literally during Ramadan, we're doing it for what? 28, 29. I'm sorry, 29, 30. And we're going all day long, sunrise to sunset. Another solution with type 1 ADHD, you go along with stimulating the frontal lobe, and we went over that last week, and the hemisphericity, the whole side, the right side. You also really want to target the right parietal lobe. When I'm talking about parietal lobe, that lobe is going to be spatial awareness. So you can actually use both the right temporal lobe and the right parietal lobe. A really cool test with a partner or a treatment, a really cool treatment is to stimulate the right parietal lobe, meaning I'm going to use my left hand. Okay, I'm going to use this. You could, as a partner, husband, spouse, parent, friend, literally what you do is you might want to, let me keep it in the camera. I'm going to snap the fingers, right? And of course, I'm cheating because I know where my hand is. Snap the finger touch, snap the finger touch, snap the finger touch, snap the finger touch, right? You train it in. All right. Now, the other person, the patient, will close their eyes. You're snapping your fingers, you touch, snap, touch, snap, touch, snap, touch. Move it, right? And now you're tying in sense of sound and sense of spatial awareness. So you're stimulating two of the biggest, the parietal and temporal. And, of course, you've got half the occiput on that side, but you've got that, when we're doing the right side, right? You're stimulating the right. I'm sorry. Yes, I'm doing it right. You're stimulating the right parietal lobe, the right temporal lobe, and you're doing it with as simple as sound. As simple as sound. You're doing that right side because you're using your left hand. In my case, I've got both hands up, but I'm using my left hand to stimulate the right side if it's that stereotypical decreased right hemisphere. With the right hemisphere, you can also really cool, especially with younger children, because they love this stuff. You can use the colors. Again, we just did sound, we did spatial awareness, and visual memory with the reaching. You can also do vision itself. The right hemisphere loves or is more activated with the colors blue, green, and indigo. So you could give your child blue, green, or indigo play glasses. You could emphasize blue, green shirts. You could do blue, green bed sheets, pillowcases. You could have blue-green colors in any artwork that you have. These are really, all of this is why I'm mentioning it, is that it's affordable stuff. I use a lot of, I'll do a lot of laser things. I have the laser that I use on myself and patients. Really cool. And that's why, and it's red and infrared. And I won't go into the definition of laser and why this is not just an LED. But if you were to order an LED light, left brain. I was typing earlier and I was writing, so I wanted to go over my left hemisphere. So what I did was I have a stand right here next to my workstation, and I'll literally, there we go. The stand, it's out here and it's lighting up the whole left side of my head. And I'm thinking, I'm typing, I'm correcting some things. So I want to do a lot of word finding, right? And a lot of word understanding. And then when I'm being more creative, I'm going to be over here. And I want to develop new ideas, put things together. Back here is your parietal temporal occipital area. So we're including all the three areas of that side. And over it, like I said, this is understanding the big picture. When I'm actually typing, what's the big picture I'm trying to achieve? And then the details, what words, paragraphs, sentences am I going to create to achieve that? The same thing can be done with LED lighting. I have a couple of panels. My children have, my mother has one. And the ranges, if you're going to think about LED lights, you want to use red and infrared, and the range is between 6 and 900 nanometers. It's not important. You don't have to worry about it. And with everything else, the contraindications there are don't use it with a pregnant person and don't use it with a person with cancer, because you don't want the energy that it's providing to speed up a cancer. You don't want to give cancer cells more energy, and you don't want to speed up the development of the fetus. Okay. But I use a lot of red light if I mention that. Oh, and now, if for those of you that remember from last week, I like contrast programs or contrast games. And again, we've got the finger game, right? Very clearly, if you weren't here last week, this is both initiation and inhibition, really important for the orbital frontal cortex, and especially with an ADHD patient, it really, research shows that it tends to light up the right side more with the inhibition and following the rules. What you're going to do, for those of you who weren't here last week, and for those of you who were, I won't make a big deal about it, I'll go fast. The parent or the husband, the wife, whoever, what you're going to do is, I would take two hands, and you're going to take two hands. Now you're going to match me and my right hand, my left hand. The hands opposite. You don't have to go your right and your left. The hands opposite of mine. I raise up one finger, you raise up two. I raise up two fingers, you raise up one. So I raise up one, you raise up two. I raise up two, you raise up one. Make sense? And then after you do that, like I said, I'd go here. You're supposed to do what you do. You're supposed to do what you do, right? Okay. Now, once you do that, like I said, my one, your two, my two, your one. This time, we can make it simple. My one, your two. My two, your nothing. Changing rules. That's where strengthening the right side, particularly the orbital frontal cortex, and it also tie into controlling your emotions better. The orbital frontal cortex is really important to controlling the emotion centers that are right behind it. So what you're going to do is inhibit, right? I do one, you do two. I do two, you don't do anything. So I do two, you, yep. I do one, you do. I 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 do. Okay. So that's how that's done. The other, what we call go, no-go game or contrast game, is the card grab. Like I said, what you're going to do, I prefer to take out the face cards. You grab the hearts and the spades, clubs and spades, clubs and diamonds. You're going to grab two different colors, shuffle them together. And then every time I flip a card, and we like to do this for time at our house to see how good we are, you flip for color. Every time it's right, you grab it with your left hand, however, whichever hand you want to. Red, grab with the left. Black, grab with the right, and just flip the colors, right? And you just grab based on, and in this case, it was left and red, right and black. Boom, 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 boom. That's your base time. Now, the new rule to train in inhibition again in the right orbitofrontal cortex is to grab based on even or odd. And if you want to keep the aces, consider that one. Even or odd. No matter what the color is, now you got to inhibit and override your first rule. Flip the card. It's a 2. Grab it with your right hand. It's a 3. Grab it with your left hand. It's a 6. Grab it with your right. It's an 8. Grab it with your right. It's a 9. Grab it with your left. Does that make sense? So these are both great, and depending on how much discipline the child has, and you can't get upset. It's keep it short. The minute the frustration levels start to ramp up, and they happen in our house because we tend to be very competitive. The minute the frustration levels start to ramp up, just stop. Make it a fun game and let the child do it to you. All right? Or the adult that we're training in, right?
I prefer actually for the youth people. That's is better. All the youth, yeah, seriously, the youth is the benefits are just listening. Me myself, yes, but the youth is very important, especially for the real high school kids.
Isn't it? It really
agree with you 100%.
It's so important to. That's why my patients and family and friends, I use the term train it in, train it out a lot. Because if I can jump back to the very beginning, with ADHD, type 1, 2, 3, with dyslexia, with whatever we're talking about, heart attack, strokes, I deal with a lot of brain trauma, right? What you do is you train out the bad habits and you train in the good habits. I remind my patients all the time, oh, it's so hard, I'm older, it's this, that, and the other thing. The idea is, especially my new patients, I tell them, one of the most simple examples I can give you is the fact that before you started coming here, you did not even know how to get here. Now, you know exactly how long it's going to take you. You know what routes you're going to take. If the traffic, what time of day you change your routes. You have literally, that's proof in your head that you learned something new. It involved traffic. It involved relationships with other people. It involved changing your schedule, creating new pathways. Every time you learn something new, you've proven to yourself that you can create a new pathway. You just have to train it in. Your brain will believe whatever you tell it. If you tell your brain you can't learn it, you can't do it, your brain believes you. If you tell your brain you can do it and you can learn it, your brain believes you. Another example, we go, you guys, I don't like public movies very much. I don't like the crowds. Again, maybe it's my right brain. But the idea is you go to a movie. Nowadays, you pay what? $5, $7, $10. You're sitting there with friends. You made these plans. You get there. You're in a theater. You should be in a real comfortable chair. Your brain believes everything you tell it. You start watching that movie, boom, the guy comes out. You jump, you get scared. You got scared by a movie. That guy, that girl, that monster was not a threat. You're at a movie, but your brain believes what you tell it, and especially what you see. That's why all those guys, they can do those tricks, and you get caught up watching something, and your brain believes more of what you see. But you can literally, you trained it in to believe the director and believe the movie. And now when something happens, you get happy, you get sad, you get scared. And it's just a movie, but you trained it in to believe it. Let's see.
And Brother Abdurrahman, something very important. a lot of people in this way they can memorize the Quran easy, regardless of the age.
Yeah, and especially with, and as the Imam said earlier, especially with children,
Yes,
you've got to realize children have a higher energy level, faster adaptability. So the earlier we get to, like I gave you the example of autism, the earlier we start working with children and paying attention to the primitive reflexes, for example. We don't have to do anything else. Let's just make sure the primitive reflexes, I test for 10, make sure the primitive reflexes are good. If that baby's not latching on, we already know there's a problem. One of the ways you can stimulate a baby, a patient mentioned, we were talking about something, and she happened to say that she, however it led into it, she told me her baby doesn't latch on real well. And I said, wow, now I know what it was. She asked me about my brain. I have brain charts. And she asked me about that. She said, oh, this and this is really interesting. And I said, yeah. And I usually with the rooting or sucking reflex because everybody knows babies already know how to eat, right? And she said, oh, our son, and she had him with her. She said, our son doesn't, he has a hard time latching on. I was like, oh, no way. Okay, let's try this. I said, do you mind? And I literally, the first couple didn't do anything. He hardly even did anything. About the third, fourth stroke, he started turning his head, and we didn't teach him how to do anything. All we did was stimulate the reflex. On her next visit, a couple days later, 2 days later, she comes in and she says, my husband and I are do this all the time, and he has started latching on like he's supposed to. Babies will not override their reflexes. That's why they're why they're there. Allah has blessed us with all this hard wiring to start with. We just have to train it correctly. And in this case, we just stimulated that reflex until that baby couldn't resist. And now he's latching on, and they don't have a problem with that baby anymore. So imagine now a 2-year-old, a 3-year-old, a 5-year-old, a late walker, horrible posture, horrible muscle tone. These are just some examples. We start working with kids, the sooner the better. The sooner the better. And especially with that real strong left drive, real weak right hemisphere, a lot of activities, a lot of not super stressful, but muscular activities. Like I used to play when I was growing up. The sister knows when we were growing up when we're in our 60s, and some of you are in your 70s and 80s. You were outside all the time. You actually did stuff. That stuff trained your brain. We used to play red light, yellow light, green light. We used to have all these go, no go games. We trained in the inhibition.